What abnormalities in urinalysis indicate a bladder infection? Have you ever wondered what the results of a urinalysis can tell you about your bladder health? A urinalysis is a common test that helps detect bladder infections, like cystitis, which is inflammation usually caused by bacteria. Several key abnormalities can signal a bladder infection when you get your urinalysis results. First, the presence of white blood cells in your urine, known as pyuria, is a strong indicator of inflammation or infection in the urinary tract. A high number of these cells usually means your body is fighting an infection. Next, the detection of bacteria in the urine, referred to as bacteriuria, is another hallmark of a urinary tract infection. Sometimes, bacteria can be present without any symptoms, but if you do have symptoms, this usually confirms an active infection. Another important abnormality to look for is nitrites. Many bacteria that cause bladder infections can convert nitrates in your urine into nitrites. If your test shows positive nitrites, it is highly suggestive of a bacterial infection. You may also see red blood cells in your urine, known as hematuria. While this is not always present, it can occur with bladder infections, especially if the infection is severe or if there are other underlying conditions, such as bladder stones or even bladder cancer. Finally, cloudy or foul-smelling urine can also be a sign of infection. While these changes might not always show up in lab tests, they are often reported by patients and can indicate an issue. It is essential to understand that while these abnormalities can indicate a bladder infection, they can also be signs of more serious conditions, including bladder cancer. Therefore, if you notice persistent or unexplained abnormalities in your urinalysis, especially hematuria, it is crucial to consult a healthcare professional for further evaluation. Bladder infections are typically treated with antibiotics, and getting treatment promptly is important to prevent complications like kidney infections or, in rare cases, sepsis. If you have a history of bladder cancer or are at increased risk, regular monitoring of your bladder health through urinalysis and other tests is recommended. To maintain good bladder health, stay hydrated, practice good hygiene, and seek medical attention if you experience symptoms like pain during urination, frequent urination, or blood in your urine. Discuss any concerns about bladder cancer risk factors, such as smoking or exposure to certain chemicals, with your healthcare provider. In summary, abnormalities in urinalysis that indicate a bladder infection include the presence of white blood cells, bacteria, nitrites, and sometimes red blood cells. These findings should always be interpreted in the context of your overall health. Always consult a healthcare professional for personalized advice and further evaluation.